will be sharing today. If you just joined, please put your name and organization in the chat. I would like to introduce our staff now, and I know you probably, if you've been familiar with our webinar, you know us all, but I'm Gina Roberts. I'm the regional coordinator with the Virginia Tobacco Control Program. We have Nicole Mann. She's their cessation coordinator here at the Tobacco Control Program. And we have Tiffany Eustace, and she is in a new role with us as their youth and young adult coordinator at the central office. So that is great news. And then we have Natalie Gospodinoff, and she's in our Fairfax Health District office. I will say we have a bittersweet goodbye today, or no, Natalie, not goodbye. It's what, see you later, right? As many of you know, Natalie, before moving to the United States, she worked as a primary care physician in Argentina for 10 years. So she will be starting an internal medicine residency at the University of Maryland Capital Region Medical Center in July. This residency is a crucial step for her to obtain her medical license in the United States. She is excited to return to clinical practice and plans to continue her career in general internal medicine within the DMV area. Natalie, oh my goodness, we wish you all the best. You're already an amazing physician. You will continue to do the work that you were meant to do. You have been an incredible asset to our team, and we will miss you. And we will definitely see you later, right? So we wish you all the best.
Thank you, Gina.
Thank you.
You're going to make her cry.
I know this might be a teary one today, right?
Thank you. Yeah, yeah.
No, exactly. Now we're going to switch to something fun. We're going to get to know some of our participants today with just a few topics maybe related to summer. So Tiffany is going to put the poll up, a few things about what you may or may not like about summertime. So let me see. It's 3 questions. So as we have summer approaching, would you rather eat hot dogs, hamburgers, or a tomato sandwich? And anybody on the call that's had a tomato sandwich knows just the right way to make a tomato sandwich. So choose that one. Would you rather enjoy your vacation at the beach, in the mountains, or at home alone, curled up on the sofa watching Christmas movies? But I digress. So choose your favorite. What is your favorite ice cream flavor? Is it chocolate? Is it vanilla? Is it mint chocolate chip? Or is it butter pecan? And you have to choose. I know we didn't put them all in here, but choose your favorite of all of these, and we will see what our audience likes. Hamburgers. I was sure tomato sandwich would actually win that one. Okay, at the beach. Let me see, home alone. So at the beach, 82%. And what is your favorite ice cream flavor? Vanilla still reigned. Okay, very good. Thank you for participating in that. Just a little fun start to our webinar. So now I have to kind of switch to a topic that is kind of, again, bittersweet and sad for us. But I do want to let everybody kind of have an update on our program, because I know you've heard about it. You've heard in the news, you've read our newsletter. And many of you are aware that as of on April 1st, the Department of Health and Human Services eliminated the CDC's Office on Smoking and Health. So our program, the Virginia's Tobacco Control Program, relies 100% on this CDC funding through OSH. Our current grant ended April 28th, and we will not be receiving federal funding at this time. So again, I think it's very disappointing for our program that we know we've had so many successes here in Virginia. But our staff, the program, and Quit Now Virginia will be here for the next few months. And we're projected until about October 31st. So just a projection, but we will be here and we will be communicating with you through that time. We will continue to update you. We will continue to keep you posted on our program as we know more. But I did want to it's always changing. We have a joke in our office that what will today bring? But what we do know is this, and we know that our program significantly reduces smoking rates, right? We know that our program significantly reduces tobacco-related diseases. And we know that our program significantly reduces deaths. And most importantly, we know that our program makes an impact on Virginians. So a healthy Virginia is a tobacco-free Virginia. And now, more than ever, I think we have to get this message across to our leaders. We know what works. We've known what works for the past several years, and we just need to continue doing it. So I encourage you, as you're out there in your communities to, and of course, in the work that you're doing, to stay engaged, to share the impact of tobacco prevention in your communities and in your networks, and to advocate for sustained tobacco control funding wherever possible, because that's what we're going to continue doing. We're going to continue working. We're going to continue this program because we have to. We know it does make a difference. And I did want to just say this as well. This is one of the best teams, the best, actually, the best team I've ever worked with. I know Mark, Kyle, Sarah, possibly Jane and Rita are on the call. All of you are really our team. You're all our family. We appreciate each of you. We appreciate your thoughts, your calls, your texts. There's been so many people checking in on us, right? Making sure we're okay. And we are, and we will continue doing what we do, and that is trying to make an impact, trying to continue the work of tobacco control in Virginia. And we appreciate your work. You're working out there too. You work every day. We have your support, and we feel it, and we know you're working. So I want to end it there right now. More to come. Questions, you can definitely put them in the chat. We'll take them at the end. But I do, on a happier note, I had the pleasure of introducing one of our strongest champions, strongest advocate for policy change, Morgan Snell. And let me see if I can find, I have all these notes here to introduce Morgan. And I think, so Morgan, Dr. Snell is an assistant professor of health behavior and policy in BCU's School of Public Health, where her research focuses on reducing the health burden of smoking and other substance use among youth and adults. She is a Virginia native who received 2 degrees from UVA before earning her PhD from BCU in 2020. And her research program priorities, community engagement, and improving health for all Virginia residents. The project she'll discuss today is focused on using available policy tools to shift the retail environment for nicotine and tobacco products so that youth may be less exposed to pro-tobacco advertising and have less access to purchase nicotine and tobacco products. So Dr. Snell, thank you so much for joining us today. I want to turn it over to you. Please, again, put your questions in the chat, your comments. We'd love to hear from you, and I will turn it over to Dr. Snell right now. Thank you.
Thank you so much, Gina, and thank you to everyone who welcomed me here today to talk a little bit about this project. And I hate to come after Gina's announcement, but I'm excited to be sharing a project that allows communities in Virginia to potentially do something in their own backyard to shift the tobacco retail outlet environment to reduce youth smoking. So I hope that I can follow up Gina's announcement with potentially an actionable strategy that you could pursue if you're interested. So today I'm going to talk about using commercial zoning policies to reduce youth smoking in Virginia. So I'll quickly talk about why tobacco retail outlet location placement and density matters. Talk a little bit about zoning and licensure. What are these strategies, and how do they work together, and how do they work separately? A recent update to legislation in Virginia that allows localities to use commercial zoning for this purpose. Some examples of how some of our neighbors are using this strategy, and then some existing tools and next steps for people who are interested in learning more. Okay, so just to start with the rationale, why would we want to regulate tobacco retail outlet placement? To promote public health and to reduce youth smoking. So there's sort of 2 specific pathways to youth smoking. The first is that your tobacco retail outlets are places where typically you see a lot of pro-tobacco advertising. We have a lot of evidence over time that greater exposure to pro-tobacco advertising and marketing is causally linked to increased susceptibility for youth to try nicotine and tobacco products. And then, of course, if they're susceptible to use, they have to physically access these products as well. So then in your built environment, if you have more readily accessible products, right, more tobacco retail outlets around you, you're more easily able to get the product that you want to try. So those are kind of the causal pathways of why you might be interested in where your retail outlets are. When we look at some of what's going on in Virginia, many of you on this call know these data even better than I do. But in 2023, we know about 3% of high school students in Virginia reported using cigarettes at least one day within the past 30 days. So that's below the national average. So we're doing pretty well there. Sorry, I'm trying to advance my slides. Okay. But when we look at accessing products, we do find that among young adults, so some of whom were 18 to 20 years old, under the legal age of purchase, about 37% of those under 21 reported that tobacco products were very easy to obtain, and about 50% reported vaping products to be very easy to obtain. When we looked at among adolescent e-cigarette users, so all under the age of legal purchase, many reported illegally purchasing their own products from stores. So on the left side, you can see the source of e-cigarettes. About 44% said they got their products from a retail source. And then on the right side, when they were asked, okay, well, what retail source? You can see about 16% reported that they purchased their own products from a gas station or convenience store, sort of a traditional tobacco retail outlet. And then about 22% reported going into a vape shop and purchasing their own product. So we do think that the retail outlet landscape matters a tremendous amount in terms of access. So this is a busy slide, and I'll just hit the high points. So when we look at vaping product use in Virginia among high school students, so e-cigarette use has overall decreased steadily, but still about 8% of high school students reported using an electronic nicotine device at least once in the past 30 days. When we look at that by age group, we see that it's about 6% of the 9th grade students, early high schoolers, and that goes up to about 11% by the time we look at 12th grade students. About 6% of male students and 10% of female students reported e-cigarette use at least once in the past 30 days. And then when we look at frequency among people who were using these products, about 4% of all high school students reported what we would consider frequent use, using vape products at least 20 out of the past 30 days. So we're doing pretty well, but we still have some work we could do for a significant proportion of high school students. So then it comes to, well, what are our options? So I'm going to talk first about zoning and then talk about licensure as well. So this project is about commercial zoning to reduce tobacco retail outlet density and prevent retail outlets from being located near youth. So the way the zoning process works is to open a new business in any locality, county, or independent city, you need to find a commercial or industrial space to buy or rent, and you apply for a permit to operate your business. Sorry. If you wanted to, for example, regulate a specific type of environment of commercial retail space, you could choose a class of products, and a locality could say, for this class of products, we're going to amend our local commercial zoning ordinance to classify those businesses as requiring what we would call a special use permit. So they might have to meet additional specific criteria before being allowed to operate. So a locality, for example, could do this for tobacco retail outlets if they wanted to do so. So commercial zoning is one of two popular policy strategies to regulate where these tobacco retail outlets are placed, and if they are near or far from youth and near or far from one another. So both zoning and regular traditional licensure programs can control the location of businesses within a community. Both of them are effective at controlling density, or the overall number of these businesses. Both of them can impose some operational standards, so hours of operation and the types of products that can be sold. Licensure has some advantages in that it can apply standards to existing businesses and grant some rights that apply for a finite period of time. It also provides some regular reinforcement of required conditions. But in Virginia, we don't currently have a comprehensive licensure program, and independent cities and counties are not allowed to preempt state law to implement their own licensure programs. However, we do have the option of utilizing commercial zoning. So in the left-hand column, you can see that, so commercial zoning is going to be able to control the location of a tobacco retail outlet within a community. We can control the density of tobacco retail outlets. We can impose some operational standards. Zoning will apply to a specific parcel of land, regardless of the business located there. Its weakness is it's a little bit tough to apply standards to existing businesses, and we'll talk about some approaches within Virginia, but it has some real strengths. And another strength is that in the 2024 legislative session, House Bill 947 explicitly gave Virginia localities the right to regulate tobacco retail outlet locations via commercial zoning. So in the ordinance itself, or in the legislation itself, it says that Virginia localities may prohibit a retail sale location on property within 1,000 linear feet of a daycare center or a public, private, or parochial school. So explicitly, we are allowed at the local level in Virginia now to use commercial zoning regulations by amending our existing commercial zoning ordinances to reduce tobacco retail outlets' ability to be located near youth in these specific locations. So we look at what some Virginia localities are doing in this space. We have a list, and we're keeping track of localities at the county and at the city and at the town level who are amending their commercial zoning ordinances to try and achieve these public health goals. So far, what we are observing is that counties and cities and towns are defining a class of product, as I talked about a couple slides ago, that they would like to regulate. So far, we haven't seen anyone regulate all tobacco retail outlets, including gas stations and convenience stores using HB 947. What we're seeing more of is that communities are choosing to target what they might see as a rise in vape shop outlets, for example, by carving out this class of establishment and amending their local zoning ordinance to say these types of establishments are not allowed to be located within X distance of schools or from one another. And I'll show you a little bit about what that looks like in practice. So 2 examples. In Chesterfield County, they adopted this amended commercial zoning ordinance in April 2023. They defined a class of retail outlets as sort of a recreational substance category that they created. And these are outlets where 25% of their inventory or 15% of their display area were dedicated to vape products, basically, and equipment. And they said that if you fall within this definition of a recreational substance outlet, you are not allowed to be located within 2,000 feet from schools, and we're imposing a minimum distance from other outlets as well. They also were able to impose some additional requirements. They said you also must close by 8 p.m. That was something that was specific to Chesterfield County. In Henrico County, in July of 2024, they adopted an amendment to their zoning ordinance, and they said, we're going to define a class of outlets where 15% of the display area is dedicated to vape shops, or they allow on-site vaping. And for these outlets, they cannot be located within 1,000 feet of schools, 2,000 feet of parks and of other outlets, and they required some additional sort of environmental parking and built environment restrictions as well. So you can see that counties in Virginia are doing this, and they're all doing it a little bit differently, but we're specifically interested in reducing density, so outlets being located too close to one another, and reducing youth access. To just quickly touch on a couple of others. The city of Williamsburg amended their commercial zoning code so that tobacco and vape outlets now apply for a special use permit rather than being considered a by right establishment. James City County defines vape shops as being eligible for a special use permit, and specifically says they're separate from drugstores, convenience stores, or grocery stores selling tobacco products. So that was an example of how county is so far. What we're seeing is that they're carving out different classes of establishments, and really maybe worried more about vape shops. And then the towns of Abington, Marion, and Smithfield have also defined a new class of alternative or recreational retail outlets that could be regulated further. And we're seeing other counties in Virginia take up this conversation about what do we want to regulate and how do we want to do it as well. So in our project, we are hoping to and working on analyzing the extent to which these outlets are clustering around priority populations in Virginia. We are working with some experts on identifying some zoning opportunities that could be scaled and adapted to fit the needs of localities in Virginia. And we're trying to build a policy toolkit to disseminate our findings. So web-based policy toolkit where people interested in engaging in this process in Virginia or elsewhere could come and find all the information that they need to get started and work their way through the process of designing their ordinance, and then thinking through some of the monitoring and enforcement implications and some health equity issues or community impact as well. I'll give you a brief overview of where we are. So in phase one, we were working on gathering information. We're working with a wonderful organization called Counter Tools to update their school location data in Virginia and add daycare locations, since that was explicitly included in HB 947. And in doing so, when we look at, say, the city of Richmond, for example, as a case study, among tobacco retail outlets, 58% in fall of 2024 were located within 1,000 feet of a school and or daycare center. So a healthy proportion would be subject to regulation if the city of Richmond were to restrict tobacco retail outlets from being located within 1,000 feet of these places. If we just wanted to look at density, in fall of 2024, 184 tobacco retail outlets were located within the city of Richmond, which was approximately 0.9 outlets per 1,000 residents. That's one way you could talk about density, right? How many tobacco retail outlets do we have for the number of people we have in this locality? Sorry, I'll skip that. When we look at some health equity outcomes in terms of where tobacco retail outlets are located, again, using the city of Richmond as an example, we looked at the tobacco retail outlet distribution by median household income. And you can see that more than 60% of tobacco retail outlets are located in neighborhoods where the median household income was under $50,000 per year, for example. So it's one way of thinking about where tobacco retail outlets might be clustering or prioritizing placement and which residents might be most exposed to pro-tobacco marketing and advertising, and which youth might have more physical access to purchase products if they wanted to purchase them. Some work in progress is we are building our county level data with some custom rankings, and we're adding some socio-demographic characteristics of residents to think through and analyze the tobacco retail outlet landscape across the state. And say something about where tobacco retail outlets are more or less dense, who's doing well, what are some characteristics of having a less dense retail environment, for example, that maybe other counties could leverage some lessons learned. In terms of our next steps, we are still collecting and analyzing some data on tobacco retail outlet locations and density, and some county and even sort of census tract level characteristics. We are engaging with our zoning officials at the Virginia Association for Zoning Officials, and they are hopefully about to kick off a research study with us to identify some barriers and facilitators to using commercial zoning successfully to reduce tobacco retail outlet density and locations near youth. And then working on building and sharing the toolkit as well. So designing a user-friendly web-based zoning toolkit and distributing it so that it's usable for both planning experts, but also community level stakeholders who want to advocate, whether it's their local planning commission or their local legislators that they want to do this. I'm going to make sure everybody has access to some resources that already exist for planning departments and stakeholders here. These are some great resources that already exist. And then I also want to quickly present our team and give my thanks. I think Lisa is on this meeting to Virginia Foundation for Healthy Youth for offering us an opportunity to engage with this product. And I want to thank our collaborators at Virginia Department of Health, at Virginia Department of Behavioral Health and Developmental Services, and Virginia Association of Zoning Officials for giving us their time and their expertise as this project continues to take shape as well. So I am going to turn it over to sort of a question and answer opportunity, and I think Nicole is going to help facilitate that.
Hi, thank you, Morgan, for that great information and great resources as well, especially, we're not sure how long our program will be here, but this is great kind of next actions on localities can take as well. We did have one clarification question. I think it's referring to your slide. I think it was 13. Laura asked, was Chesterfield grandfathered in since they adopted a 2,000-foot limit? So I think it's because the bill was passed in 2024, but Chesterfield passed their ordinance in 2023. They're able to keep that 2,000 feet limit, correct? They don't have to go down to like the one, and I'll give you time to go back. And you're on mute as well if you're
Yes.
talking.
Okay, here we are. Sorry. I clicked on a whole bunch of things all at once and it didn't go as I planned. Sorry. So I'm going to go back. So they are not, there's no need to grandfather anyone in, is what I would say. Everyone is allowed to do this differently. So HB 947 explicitly gave localities the legal right to use commercial zoning to achieve these goals. But it did not restrict, for example, Chesterfield County from imposing more strict limits. And that's also why in that slide, as I go back, you can also see that, for example, in Chesterfield County, they also chose to impose a mandatory closing time of you must close by 8 p.m., for example. Henrico County chose not to do that. And neither of those is included in HB 947, but commercial zoning at the locality level is very flexible. And it comes down to what you're trying to achieve. So it's important to talk about what are we hoping to achieve here and for whom, and what are the restrictions that we want to impose, but they can be different from one another. And they're not limited only to that 1,000 feet from schools and or daycares.
That's great. Thank you so much for that clarification. Let me just check. I think people are still kind of thinking about their questions, but we did have some during registration. And let me go back. There were some questions about enforcement of underage sales. So just kind of that's under DBHDS. So like counter tools when Morgan was talking about that. So part of that is also retail education. So if you go on the website, you can also kind of see CSBs go in to different retail outlets and they do like an assessment. And I think you can see that online as well, the questions they go through. So that's even assessing, are there products, I think it's like 3 feet from the floor because they kind of look at products if they're, within that eye kind of range for children. They look at, what's kind of not advertised, but like what is like on the countertop. There's like different things they assess. And so with that assessment, they educate the retailer as well, just so they know, these things are more kind of seen through the kids' point of view rather than like adults. And, they look at products that are, behind the counter. You'll notice that too. And they also give, I know when I go, they give like the countertop, like the mat that goes on top of the countertop, and I've seen it that they have like just to educate people that come in as well. And what else do we have? And you talked about the feet from school. So is 1,000 feet the minimum that they would do for this ordinance? Is that just like the recommended? Because I know you said there's no maximum.
Yes, and so so House Bill 947 also wasn't a mandate. Does that make sense? It's
Yeah,
just making it explicit that counties and independent cities have the legal right to engage in this commercial zoning process. So that's what's in House Bill 947. But I think the nice thing about commercial zoning, and also the challenging thing about commercial zoning, is that it is wide open from that perspective. But House Bill 947 at least means that you could engage in this process knowing that you weren't going to face potentially a legal challenge. For example, if you wanted to impose a minimum threshold of 1,000 feet from schools or daycares via your local commercial zoning laws.
Can I ask a question, Nicole?
Yeah. Go ahead, Tiffany.
Thanks, Nicole. I was wondering, Morgan, what would be an ideal zoning? And maybe you're going to talk about, or maybe it depends on the locality and what their needs are, but just like from all your research and studies, like what does an ideal zoning look like? Is it 1,000 feet, 2,000 feet? Does it really matter if they close at 5 p.m.? I was just kind of curious what your thoughts are about that.
That's a really good question. And I think what we're hoping to get from our Virginia Association of Zoning Officials collaborators in this next step of our project is to have them help weigh in on some of the challenges that I think counties are facing as they are crafting these commercial zoning ordinances that look very different from one another, and to start to coalesce around a set of strategies that we think of as meeting public health goals and also feasible. So what I'll say is, because this is a process that is so open at the locality level, there's wide latitude to use commercial zoning to address a challenge in your community or maintain the good work, right, that's already happening. Or maybe you have very low density and you just want to keep that, you want to support that. But the two examples I would give are, if you're in Chesterfield County and if you're in Arlington County, you are probably going to define density very different. So if you're in Chesterfield County, you might, for example, maybe you would do 2,000 feet from schools and other outlets, or you could consider trying to figure out how to restrict the number of retail outlets you want per 1,000 residents, because it's not as dense. In Arlington County, where the population density is higher and the retail outlet landscape is more dense as well, maybe this wouldn't be 2,000 feet from other outlets. Maybe it's 500 feet, as you see in some cities. So I just think where you are in the state, because we're a state that has such diversity in terms of how our residents are living and the commercial zoning landscape, you might choose different things. So I hope we're able to, with the toolkit, present the things to think about. And then the second thing I would say about that, not to go on too long, is this isn't an official finding to report yet, but in conversations we've had, one of the challenges of having such a specific definition, as you would see in Chesterfield County's zoning ordinance, is that it's now a monitoring and enforcement challenge. Because the people who are doing monitoring and enforcement for commercial zoning ordinance and special use permits are people in your planning department. And they're going out at regular intervals to ensure that people who have special use permits for all different kinds of businesses are meeting the guidelines for having that special use permit. And so going into a vape shop here in Chesterfield County and estimating 15% of their display area or more dedicated to electronic nicotine products, or 25% of their inventory in the back, that's a little bit easier. But it's really, really challenging. And so they have this very carefully crafted, well thought out, rational definition of who they're trying to regulate. But then on the back end, it's incredibly challenging to enforce. And if you wanted to say, we're going to make this, we're going to regulate all tobacco retail outlets, including gas stations, convenience stores, and grocery stores. We're just going to say every tobacco retail outlet, if you sell nicotine products, you must be a minimum distance of 1,000 feet from schools. That's much easier to enforce, but you may also face a lot more resistance from your local retailers as you're trying to pass your ordinance. You know, you have business owners who are going to have an interest in this process as well. And so there's always going to be this balance of what's the ideal ordinance for your community to meet your goals and what is feasible in terms of getting the ordinance amendment that you want, and then how are you going to monitor and enforce it? And then what's the pace of change going to be? One question for these types of, you know, in a traditional licensure program, every year you get to tell people if they're not meeting the guidelines, and then they don't get a license to operate, right? The pace is so quick of seeing change towards your public health goal. Commercial zoning, you're attending to have sort of a sunsetting approach is what most counties are doing, so that new businesses are subject to these regulations. And then if a business that exists already closes, you know, nobody can open up nobody can open up a new business in that location with the old guidelines, but they're not subject to the new guidelines. So the pace of change is a little bit slower as well. So anyway, those are just some things to think about. And I hope with the toolkit, we'll be able to harness harness the knowledge of our experts and their experiences so far doing these things to provide those lessons learned and coalesce around what are some best practices, at least, even if what that looks like from a commercial zoning ordinance standpoint is different in Chesterfield County versus Arlington County.
Morgan, I had a quick clarification question since you're on this slide. So did Chesterfield actually have the definition using vape and tobacco products? So they are taken in gas stations and convenience stores, or not?
They're not. So
No.
they were carving out, their goal was to carve out this class of recreational, what they called sort of recreational substances. And so for them, that is vaping products, hemp, and a whole list of others, because they're really trying to target vape shop outlets. And so this just means if 15% or more of the display area is dedicated to vape and or tobacco products, you're a vape shop outlet. Does that make sense?
It does. It does. Thank you.
And so
Yes.
if like 14% of your display area was dedicated to vape/tobacco products, you might be a convenience store, for example, because then you have the right retail mix to not be tipping into this other category.
Okay, thank you.
Yes.
And we had two questions come in. So the first one is just to clarify the 1,000 feet, is that from property line to property line, or is it like front door to front door?
I believe it's front door to front door,
Okay.
but I could clarify that. It could be from, I can clarify that and find out and circle back with everybody.
Thank you. And then the other question was about your toolkit. Is that ready yet? And if not, how do you see sharing that with the community?
So it's not ready yet. We want to incorporate some of our phase 2 of our project, which is conversations with our Virginia Association of Zoning Officials experts. And then we need to do a bit of a process of testing using some what we call user-centered design. So building the pieces, asking people to do tasks and see if they were able to do that. So for now, we're trying to make available community support in the form of slides like this, existing resources, and things like that. And then when the toolkit's available, or when we have what we think is close to final version of it, we're hoping to host it online and ask our collaborators to help us disseminate it to stakeholders. So asking our friends at Virginia Department of Health, asking our friends at DBHDS, letting people know through Tobacco Free Alliance of Virginia and Virginia Youth Tobacco Projects Coalition, American Lung Association, American Heart Association. So we're hoping to use our partners who are interested in this topic to help us reach as many people as we can. And I could also see hosting some events with planning commissioners. We promised we would report back at the Virginia Association of Zoning Officials annual conference as well. So we're going to try and cover as much ground as we can, but welcome suggestions for anywhere else that we could do this.
Definitely, that sounds great. I know for us, we have our monthly newsletter, so happy to share that there as well. TFAB, of course, they have their newsletter as well and can share information. So I think definitely sharing with the partners, people will be happy to get that information. So great to know. Just someone I think was a little excited and wanted that information now.
Yes, and I'm happy to share any information on what exists now, even though it's not our toolkit, and what we do have available. I'm happy to. And I have my email in this presentation. I'm happy to share this presentation that has our contact info and have done that already for a couple different localities. As they've started to have these conversations, we're happy to do that.
Perfect. Thank you.
Yes.
All right. Let's see. Gina or Natalie, do you have any other questions to add, or anyone else too shy to ask? You have some time and opportunity right now.
Yes, I think we have about 15 more minutes, so you may get a few minutes back on your day. If there are any questions, please, as I'm wrapping up, please put them in the chat. Thank you, Morgan, for presenting this. As you said, I think at the very beginning of your presentation, as we are going through these changes, right, this could be an action step that you, our partners in the communities, kind of look toward to continuing this work as we move forward. And that's one thing I do want to let everyone know as well. There will always be open communication from our team to you at any time. Definitely reach out to us and we will provide any update we can give. We are planning another Tobacco Free Tuesday webinar. We're not sure of the date yet. And the webinar that we're planning is kind of like a webinar to kind of talk with our partners about things that we can continue, each of our partners, to do to continue the tobacco control work in Virginia, the things that will continue, the Virginia Foundation for Healthy Youth and their work that they're doing, and the work of our other partners with their local health districts, with their local universities in Virginia. There's so much work that will continue, and how we can kind of strategize to make sure that we make the biggest impact. And of course, is there additional funding that our program can look to? Is there additional funding within the General Assembly, with taxes, and with dual funding, with other things that very well we may be able to access, but that will come in the future. So our next Tobacco Free Tuesday webinar will kind of give an additional update and maybe some more actionable steps that we can all take to make sure this tobacco work continues to be successful in Virginia, as I know it will. We are here for you. We will always take your questions. Don't hesitate to reach out. We thank you for what you're doing in your communities to make that impact in Virginia. And we know this is what works. So we will continue to do it. We will be here. So please reach out. And I do not see any other questions. Nicole, correct me if I'm wrong. But so thank you for attending. Thank you, Morgan, for joining us.
I have a last question.
Yes.
Sorry to interrupt.
No.
I have one last question for Morgan. So for my experience in the past few weeks here at working locally with a health district, on this zoning ordinance. Have you thought of like if there's a specific definition or suggestion for what a childcare center is? If if they're going to take into account what kind of childcare day centers, because I think that could be sometimes pretty broad. I don't know if other localities have had experience with that and how they managed to come around what they're going to include.
It is really broad, and we ran into that challenge working with Counter Tools and trying to decide what data points we could add to their map. Is a licensed child day centers as on the Department of Education or Department of Social Services website? Is it, do we include unlicensed? What about in-home providers? What about, churches, et cetera? So that's a good question. And I think it all comes down to what is your goal? So in HB 947, they included these daycare centers, but if you want to reduce the advertising kids are seeing even at a young age in your community, yes, you want to include them in your commercial zoning ordinance amendment, right? If you're worried just about youth purchasing products, for example, above reading age, maybe you just want to define your distance from elementary, middle, and high schools, for example, and maybe you don't include daycare centers. So I think you're right that it's incredibly hard to define. There's not one right way to do it. But we landed on that if you're a licensed daycare provider or a private or parochial center that is listed on the Department of Social Services website, you're on that map right now. But people could all do it differently. And I think it just comes down to what you're trying to do and who you're trying to target and what the rationale is, right? What's the link there? For me, I would think that kids from elementary school, middle school, and high school might be my target if I was designing my perfect ordinance. And I maybe wouldn't wrestle with the daycare center, but young kids see this stuff too. So, maybe it's really important. It's a good question.
Yeah, and they are at an age where they're susceptible to the
Yeah.
advertising and the messaging. So yeah.
Right, because we know prevention is such an effective tool. So yes, there's no wrong way to do it, but it is really important to think about, how to define it.
Thanks, Morgan. We did have one question just about our tobacco control program materials, just in case, October 31st does come around and we no longer have funds. We do have plans to make sure that we have our materials online. There's a lot of materials online that you are welcome to print, that you can download. We're also trying to see where these materials can live in the future, just so we can share information, even other programs, some resources, reaching out to other programs within VDH to ensure that, tobacco cessation information is still shared through VDH and other programs, even without us. So you should be getting the information probably in our newsletter. If you have more specific questions, you can definitely reach out to us and email us individually as well. And Natalie put that information online, and we do have a material order form as well. So definitely reach out to us if you have anything specific, but we have tons of one-pagers online, our brochures online, you can download and print as well. So Sarah worked very hard on making sure things are updated. More things we wish we had more time to update, but there's definitely a lot of information that is on there that we love to share. So thank you.
Thank you, Nicole. And thank you, everyone. Have a wonderful summer. We will be talking probably before it's over, and enjoy your week. Thank you so much.